Your knees are incredible joints, allowing you to walk, run, and jump. Every time you take a step, leap, or even just stand up from a chair, your knees are hard at work, supporting your body and absorbing impact. They're essential for almost every movement you make throughout the day. Inside your knee, strong bands called ligaments connect bones to bones, providing crucial stability. These ligaments act like sturdy cables, holding the joint together and making sure everything stays in place, no matter how much you move. Without ligaments, your knee would be wobbly and unable to support your weight. You'd find it nearly impossible to balance, let alone walk or run, because the bones would simply slide apart. Ligaments are made of tough, fibrous tissue designed to withstand force. They're built to handle the stress and strain of daily activities, from gentle strolls to intense athletic movements. Their main job is to keep your knee joint stable and control its motion. They work constantly, even when you're not thinking about it, to guide your knee through safe, controlled movements. They prevent your knee from bending or twisting in harmful ways. This protection is especially important during quick changes in direction or sudden stops, like when playing sports or catching yourself from a fall. For example, they stop your knee from bending too far backward or twisting too much to the side. This helps prevent injuries that could sideline you from your favorite activities. This control is essential for everything from standing up to playing sports. Whether you're getting out of bed, climbing stairs, or sprinting down a field, your ligaments are always working behind the scenes. The knee is one of the largest and most complex joints in your body, bearing significant weight with every step. It's responsible for supporting your entire upper body, making ligament strength and health absolutely vital. Ligaments ensure the thigh bone, shin bone, and kneecap move together correctly. They coordinate these bones so your knee bends and straightens smoothly without slipping out of place. Think of ligaments as the ropes that hold a bridge steady, allowing safe movement. Just as a bridge relies on strong cables for support, your knee depends on ligaments for strength and stability. Healthy ligaments mean smooth, pain-free knee function. They let you move freely and confidently without worrying about your knee giving out. If ligaments are stretched or torn, your knee can become unstable and painful. Even a small injury can make it hard to walk, run, or enjoy your usual activities. This instability can make daily tasks and physical activities difficult. Simple things like climbing stairs or getting up from a chair can suddenly become a real challenge. Maintaining ligament health is key for an active, comfortable life. Regular exercise, stretching, and proper care can help keep your ligaments strong and flexible. Protecting your ligaments helps prevent injuries and keeps your knees strong. Wearing proper gear and using good technique during sports can make a big difference. Appreciate your ligaments. They're your knee's personal support system. They work tirelessly to keep you moving, so it's important to give them the care they deserve. Take care of them, and they'll take care of you, helping you stay active, mobile, and pain-free for years to come. Your knee's stability comes from 4 main ligaments, each playing a crucial role in keeping you moving safely and efficiently. These ligaments are like strong, flexible bands that connect your thigh bone to your shin bone, working together to support every step, jump, and twist you make. Each ligament has a unique job, and understanding their functions can help you appreciate just how complex and remarkable your knee really is. The anterior cruciate ligament, or ACL, sits right in the center of your knee. It's responsible for controlling the forward movement and rotation of your shin bone, making it essential for stability during activities that involve pivoting or quick turns. The ACL is especially vital for athletes who play sports with sudden stops or rapid changes in direction, like soccer, basketball, or football. Because of these intense movements, the ACL is one of the most commonly injured ligaments in the knee. The posterior cruciate ligament, or PCL, also sits in the center of the knee, just behind the ACL. Its main job is to prevent your shin bone from moving too far backward, acting as a strong anchor during activities like walking downhill or landing from a jump. The PCL is actually stronger than the ACL and is less likely to be injured. However, when it does get hurt, it's often from a direct blow to the front of the knee, such as during a car accident or a hard fall in contact sports. On either side of your knee are the collateral ligaments, which provide side-to-side stability and help keep your knee from moving too far in or out. The medial collateral ligament, or MCL, is found on the inner side of your knee. It stops the knee from bending inward and is crucial for protecting your knee during side impacts. MCL injuries are common in contact sports, especially when there's a hit to the outside of the knee, forcing it to bend inward. This can happen in football, rugby, or even during a fall. The lateral collateral ligament, or LCL, is located on the outer side of your knee. Its job is to prevent the knee from bending outward, providing balance and support during side-to-side movements. LCL injuries are less common than MCL injuries, but they usually result from a blow to the inside of the knee, pushing it outward. These injuries can be serious and often require careful rehabilitation. Together, these four ligaments, ACL, PCL, MCL, and LCL, work as a team, forming a strong network that keeps your knee stable and functioning properly. They allow your knee to bend, straighten, and rotate safely, supporting you through everything from walking and running to jumping and turning. When even one ligament is injured, the entire system can be thrown off balance, affecting your movement and increasing the risk of further injury. Knowing the roles of each ligament helps you understand not only how injuries happen, but also how to prevent them and keep your knees healthy for years to come. Protecting all four ligaments is essential for knee health, whether you're an athlete, a weekend warrior, or just want to stay active and pain-free. These ligaments are truly the foundation of your knee's strength and stability, allowing you to move with confidence every day. Knee ligaments are strong, flexible bands of tissue that connect the bones in your knee and help keep the joint stable during movement. They play a crucial role in allowing you to walk, run, jump, and pivot with confidence. But even though they're tough, ligaments can tear if they're pushed beyond their natural limits or exposed to sudden, intense force. Tears often happen during sudden, forceful movements, like quick direction changes, abrupt stops, or awkward landings in sports. These actions can put enormous pressure on the knee in a split second. Twisting motions, especially when your foot is planted and your body turns, put stress on the ACL, the ligament most commonly injured in athletes. Meanwhile, direct blows to the outside or inside of the knee, like a tackle or a kick, can injure the MCL or LCL, which helps stabilize the sides of your knee. Car accidents are another common cause of ligament injuries. If your knee hits the dashboard, the force can damage the PCL, which is located at the back of the knee. Overextending the knee or hyperextension can also cause tears, especially in the ACL or PCL. This often happens when landing from a jump or missing a step. Ligament tears vary in severity, ranging from mild, where the ligament is just stretched, to moderate, where it's partially torn, and severe, where it's completely torn and the knee feels unstable. High-impact sports, weak muscles, poor technique, and fatigue all increase your risk of injury. Not warming up properly or using bad form can make your ligaments more vulnerable. Even everyday activities, like slipping on a wet floor or missing a step at home, can cause a ligament tear if your knee is unprepared or your muscles are weak. Recognizing risky movements and learning how to move safely helps you protect your ligaments from unnecessary strain. Prevention starts with awareness and proper training. Practicing good technique and building strength are key steps. Strong muscles around the knee, especially the quadriceps and hamstrings, offer extra support and help absorb shock during movement. Stay mindful during activities, warm up before exercise, and avoid sudden, excessive stress on your knees to reduce your risk. Understanding how tears happen is the first step to prevention. Knowledge empowers you to make safer choices. Take care to keep your knees safe and strong so you can stay active and enjoy life without pain or injury. A torn knee ligament sends clear warning signs. You might hear or feel a pop at the moment of injury, especially with an ACL tear. Pain follows, sometimes sharp and immediate, sometimes building over hours. Swelling often appears quickly, making the knee look and feel puffy. Instability is common. Your knee may feel like it's giving way or can't support you. Bruising and limited motion can also occur, making it hard to bend or straighten your leg. These symptoms signal a serious injury needing medical attention. Don't ignore them. See a doctor for proper diagnosis. Early care leads to better recovery and less long-term trouble. Doctors start by asking how your injury happened and what symptoms you feel. They examine your knee for swelling, tenderness, and stability using specific manual tests. X-rays rule out broken bones, while MRIs show ligament tears and other soft tissue damage. These tests help pinpoint which ligament is injured and how severe it is. Accurate diagnosis guides the best treatment plan. Quick, thorough evaluation is key for recovery. Trust your doctor's process. It's designed to get you moving again safely. Treatment depends on which ligament is torn, how severe it is, and your activity level. Many mild or moderate tears, especially of the MCL or LCL, heal with rest, ice, compression, and elevation, known as the RICE protocol. Pain relievers and physical therapy help restore strength and motion. Physical therapy is crucial for nearly all ligament injuries, guiding safe recovery. Severe or complete tears, especially of the ACL in active people, may need surgery. Surgery often involves replacing the torn ligament with a graft. After surgery, physical therapy is essential for regaining full function. The goal is always to return you safely to your activities. Your treatment plan is tailored to your needs and goals. Recovery time varies by injury and treatment. Minor sprains may heal in weeks. Major tears or surgeries can take months to a year. Early recovery focuses on reducing pain and swelling, then regaining motion and strength. Rehabilitation progresses in phases, with exercises becoming more challenging over time. Returning to sports takes patience and mental readiness, not just physical healing. Communicate with your healthcare team and follow your rehab plan closely. Everyone's recovery is unique. Don't compare your progress to others. Diligence and patience are key to a full, safe return. You can lower your risk of knee ligament injuries with a few smart habits. Strengthen and stretch muscles around your knees, hips, and core. Use proper technique in sports and exercise, and wear the right footwear. Progress gradually in your workouts and listen to your body. Warm up before activity and cool down after. These steps help keep your knees healthy and injury-free. Knowing how your knee ligaments work helps you protect them and stay active. Early recognition of injury leads to better outcomes and faster recovery. Understanding treatment and recovery prepares you for the healing journey. Being informed lets you make smart choices and ask the right questions. Strong, healthy knees support your independence and quality of life. Take care of your knees. They're built to last, but only with your help. Knowledge is your best tool for lifelong mobility and well-being.